Okay, hello everyone. My name is Shirley Tran, and today I'm going to share my thoughts, my insights, my review of a documentary called The Bleeding Edge Medical Ethics and Policy in the U.S. Healthcare. Um, so, it really opened my eyes on the serious issues of medical devices in the U.S. healthcare. Really question how these medical devices are being used, too. So these are the contents that we're going to go through. So we're going to review the bleeding edge. I'm going to give you like a little summary of what it is, ethical issues of medical devices, the importance of it through laws and policies, and then a conclusion. So, The Bleeding Edge, it's a Netflix documentary about the use of medical technology and how it's harmed people in real time, people putting their lives at risk and putting their trust in their healthcare providers and the healthcare system, only to have them be harmed in the process. And then it basically shows the cultural incompetence of healthcare for not testing these medical devices beforehand. So, the film really goes into detail and it showcases people and their stories on how they were harmed by these medical devices. And, you know, these, effects are, some of them were long term. Most of them were just pain, injury for not a short period, but still pretty lengthy. Um, so the ethical issues and medical devices. So there was a lack of awareness, informed consent, the profiting over people, these companies, and consistent loopholes in the FDA. So there was something called the 501(k). That was one of the biggest problems that the show or the documentary showcased, was that the FDA was approving these devices because of this rule, the 501(k) rule. Approving something that's already similar in the market, and so there's no need to do safety measure tests on them, and so it's shipped to hospitals, and then these hospitals are basically experimentally testing on these patients. So that was really shocking to me, and my biggest insight from this whole documentary. um, But yes, the media items, for example, in the documentary were Assure, which is a device for female sterilization, and then hip implants. And so, really, when it comes to ethics, these patients weren't really told of these really big risks. And some didn't even know the devices were experimental, right? Because those were the those were sent without even being safety checked and whatever. And these companies, right, that are making these things, they really care more about the profit rather than, you know, the outcome or the people. So, how is it relevant to this course? Well, patients are putting their trust not only in the healthcare providers, but the system as well. And so, um, for me, I think it's really important to advocate for the patients and being informed. I don't like to be told something before someone does something on me in a hospital. There's something called informed consent. I need to be okay with what you're going to do to me, and ethical um, care overall. And so it made me realize the importance of to be a voice for these patients and educate them on what their options are. And then I also mentioned enforces the issue of bringing up ethical accountability, which is true, education on those who lack knowledge, and transparent um, regulation. So, my thoughts, if you haven't seen the documentary, it's a really good one. I definitely recommend it. Maybe watch it with, a friend or your parents. It's really good to be informed. Um, I especially liked knowing about the impact of poor healthcare policies and what we can do to better them. Yeah, thanks for listening.